Hi, good morning. My name is Dr. Pankaj Talwar, and I welcome you back again to our channel called Matritva, in which we cover your queries about IVF. One common query which we get from all of you from multiple sources is that pregnancy with small uterus. आप जानना चाहते हैं कि मेरा गर्भाशय या यूट्रस छोटे साइज का है, कैन आई बिकम ए मदर, कैन आई conceive, and in case I conceive, can I continue with my pregnancy? This is not a very uncommon query, and it comes after you visit an IVF doctor and they have done your ultrasound and they give you a diagnosis called small uterus. So today I'll talk to you about pregnancy and fertility with a small uterus. Now, what is a small uterus? For this you have to know that the size of the uterus, जो गर्भाशय का जो साइज है वो तकरीबन 7 सेंटीमीटर का होता है. And when the size of the uterus becomes less than 4.5 or 4 centimeter, we say that the lady has got a small uterus. It's quite a rare diagnosis, but the term is very commonly used in an appropriate way. So how do we diagnose small uterus? It is commonly diagnosed by doing an ultrasound or a 3D scan or by an HSG, where the comment is given by the radiologist or a sonologist that the lady has got a small or hypoplastic uterus. तो सबसे पहले हम बात करेंगे कि क्या कारण होते हैं जिस कारण से a woman can have a small uterus. As I've told you, any uterus less than 4.5 or 5 centimeter can be worrisome. And in which all conditions does it occur? The growth of uterus depends upon the play of hormones in the body. When the ovaries, जिन्हें हम अंडकोश कहते हैं, जब उनसे डिम बनते हैं, when they make eggs, they make lot of hormones. That is called estradiol. The estrogens will act upon the uterus and make it grow, and they normally sustain themselves between 6.5 to 7 centimeters. Due to any reason in which ovaries are not working, जब किसी की ovaries काम नहीं करती हैं, so body में hormones की मात्रा कम होती रहती है और उस कारण से यूट्रस छोटा होना शुरू हो जाता है, यूट्रस सिकुड़ जाता है. So we call it premature ovarian failure. This means that ovaries have failed prematurely. Normally in a woman, the ovaries will continue working till between 46 and 51 years. But when ovaries they fail around 40 years of age, we call it premature ovarian failure or early menopause. So any condition which can lead to failure of ovaries earlier, that can lead to a small uterus. This is one of the commonest presentations of a woman who comes to us who has got a small uterus. The other conditions can be problems in terms of developmental issues. जब एक गर्भाशय बनता है, when the uterus grows, it comes in two parts. So there are two parts of the uterus which combine together and form a proper uterine cavity and the body. Due to some reason, in case one part doesn't develop well, then the uterus can be unicornuate and we say uterus is small or hypoplastic. This is very commonly diagnosed by carrying out an ultrasound or an HSG. So always remember, in case somebody says that you got a small uterus, get a 3D color Doppler done and try to establish the uterine cavity size. Uterus के अंदर का जो हिस्सा होता है उसे हम कहते हैं cavity और endometrial cavity, and this cavity size should be more than 2 cc. In case the uterine volume, cavity volume is less than 2 cc, we say that the lady has got a small cavity. So all these conditions which may lead to a small uterus or a hypoplastic uterus can lead to lack of fertility, failure of fertility, and it may also lead to recurrent miscarriages, abortions or pregnancy losses. So अभी हम जानेंगे कि क्या तरीके हैं by which we can increase the size of the uterine cavity, end of the uterus. Now we have to understand, अगर एक uterus शारीरिक तौर पर ही छोटा है, it's got a congenital problem और वो बना ही छोटा है, we can never increase the size of the uterine cavity or of the uterus. But in case the uterus is small due to early menopause or a condition like PCOD, even in PCOD sometimes the uterus can be of small size. In these conditions, yes, we can intervene and make the cavity and the uterus bigger. So how do we do it? It's very simple. When the uterus is small due to menopause or premature menopause or premature ovarian failure, in such cases we can give the lady hormones. हम आपको कुछ tablets खाने के लिए देंगे. They basically contain estrogen, and when you take it for a long time and you start getting your periods, the uterine cavity and size will increase, and then it will become normal for conception. This can be easily done. So by taking these tablets, the uterine cavity and size can increase, but here we have one problem. The problem here is that ovaries are not working. So whenever there is uterine size anomaly, जब uterus का size छोटा होता है, and the reason is premature ovarian failure or menopause, there are no eggs being formed in your body. Ovaries have failed, ovaries are not working. So what we can do is we can give some tablets to increase the uterine size, and later on you can take help of donor oocytes and conceive. Donor oocyte is a very simple technique in which we take the eggs from a healthy young woman and give it to you. Meanwhile, as the lady is being stimulated, when we take a donor and we start making her eggs, same time for 2 to 3 months we'll give you some tablets to increase her uterine size, and after the eggs have been taken, we will take the semen sample of your husband और हम दोनों को मिलाकर we'll create embryos and give it to you. So donor oocyte is a very good method to treat the women who have got small uterus due to premature ovarian failure or early menopause or menopause. So in case somebody tells you that you've got a small uterus, don't be worried. Always try to find out, why do I have a small uterus? Go to a good doctor, you will come to us, talk to us, and I'm very sure that majority of these conditions are treatable and we'll be able to help you. So thank you so much for being with me. Thank you so much for listening to me, and I'm sure that we'll mutually benefit with this interaction. In case you've liked this video, please subscribe, please share. It will benefit a lot of people around you who have a similar problem. We are always here to help you 24/7. Please free to mail us, text us, WhatsApp us, or leave a message for us. We are available on Twitter, Instagram, LinkedIn, and all social media platforms. Thank you very much. Till we meet again. Dhanyavad. Jai Hind.
Thank you.